Hi everyone, my name's Eddie Wu. I'm an orthopedic surgeon with Premier Orthopedics, and I'm here to talk to you today about arthritis involving the hip and knee and a little bit on total hip and knee replacement. So there are several forms of arthritis. Probably the most common form is what we call osteoarthritis or degenerative joint disease. It's mostly a wear and tear type of arthritis where the ends of the bone and the cartilage surrounding the ends of the bone begin to deteriorate, resulting in pain and possibly areas of exposed bone. There's a breakdown of that joint cartilage, and as a result, much of the lubrication of the joint is decreased because the fluid that actually lubricates your joints are secreted from the cartilage, which has now deteriorated. There are several degrees of arthritis that we see, mostly diagnosed on x-ray. As you can see in the presentation behind me, your picture on the left is a picture of a normal knee. There is a wide space between the ends of the femur and the tibia. Your picture on the right shows that space is severely compromised and resulting in potential deformity. As you can see on the picture on the right, if certain compartments in the knee are involved, that can result in deformity of the knees, resulting in bow-legging or becoming knock-kneed, as you see on this picture. Very similarly on the hip, the ball and socket is also coated with cartilage to allow a smooth articulation. In arthritis, that cartilage is broken down, and as you can see on your right, the joint surface is decreased when compared to the picture on the left, which is a normal hip x-ray. Symptoms of arthritis involving the hip and knee include stiffness and pain. When you're talking about the hip, the groin is probably the most common area of pain, followed by the thigh and even potentially the knee as the pain radiates down. You can have swelling and inflammation around the joint, especially the knee. You have difficulty with going up and down steps or with prolonged activity or walking. And with the hip, it's very common to hear patients having trouble putting on their socks or shoes because they simply can't bend their hip to get that foot closer to their hands. This is an animation of an actual hip replacement. During a hip replacement, the hip is actually dislocated so we can gain access. The ball is removed. The socket is replaced with a combination of a metal and plastic component, and that's grown into bone, or what we call press fit for the most part. And on the femur, a stem substitutes as the ball aspect of it, and that gets replaced with a metal or ceramic head, and that is now your new hip replacement. And on the knee side, once we get down to the actual joint, the ends of the bone are removed and all the diseased portions of the knee are removed. And that's made to accommodate a metal femur, and on the tibial side, a metal tibia along with a plastic liner. That is now your new knee replacement. Now at Premier and Inspira, we offer robotic assisted total joint replacement, which certainly adds an unparalleled level of precision to a fraction of a millimeter. And very briefly, how that works is we obtain a CAT scan of your knee, which generates a three-dimensional model. And this is actually a patient that we did a few months ago, where I actually am able to plan out the surgery and what levels of bone that I'm removing prior to doing anything. And the amount of bone in different planes is templated. During surgery, several marks in the knee during live during surgery are obtained to cross-check the model and to make sure everything is as accurate as we planned. Prior to doing any cuts or any more invasive surgeries, we actually have a pre-operative plan to see exactly how much opening and what the implant's going to look like when implanted. This is all during surgery. Finally, using a saw, we're able to basically navigate through the knee during surgery to make sure that the most minimal amount of bone is removed and to execute that personalized plan for you to the highest degree of accuracy. At Premier and Inspira, your safety is our number one concern. So if you're considering total joint replacement with us during the pandemic that we're all going through, I wanted to bring up a couple things that we're doing to help minimize your risk of exposure. At all three of our divisions, every hospital employee is temperature checked and screened at the door. Every hospital employee in position is required to wear a mask to help minimize the risk of any respiratory droplet transmission. All of our rooms are private, and so you'll be able to recover in your own setting without having another patient in the room to help minimize the risk of germs from other patients. All of our patients undergoing elective surgery are required to undergo a preoperative COVID test within 96 hours to help minimize the risk of any asymptomatic carriers. So when you're in the preoperative holding area, all the patients that you see around you have been COVID tested and they are all negative. And finally, after total joint replacement, patients are encouraged to mobilize and walk with physical therapy a few hours after surgery to help increase your chances of being discharged back to home within the first day or two after your procedure. What that does is it minimizes the risk of infection as well as your exposure during the pandemic. So when you're thinking about total joint replacement and all your other orthopedic needs, think Premier and Inspira, the team to trust.